Hello everyone. Today we'll be talking about Chamberlain's 10 rules of normal ECG. He is Professor Chamberlain, who is a British cardiologist, and he has done a tremendous work in the pre-hospital clinical care. And he also has given 10 rules of identifying normal ECG. Or इस presentation में I'll be covering these rules one by one, so which will help you to identify the ECG in a better way. तो हमारा first rule क्या कहता है? As per rule number 1 by Professor Chamberlain, the PR interval should be 120 to 200 milliseconds. Okay, यहाँ पे milliseconds भी दिया है, but for your easy understanding, remember it in the seconds. तो आपका जो PR interval है, PR interval क्या है? From the starting of P wave till the starting of QRS complex. This interval should be between 0.12 to 0.20 seconds. मतलब 3 to 5 small squares. If it is more than 0.20 seconds or if it is less than 0.12 seconds, it is abnormal, right? हमारा second rule क्या कहता है? As per rule number 2, the width of QRS complex. This is the width, okay? This is your QRS complex और ये इसकी width है. As per rule number 2, the width of QRS complex should be 0.11 seconds or less than that. It should not be more than 0.11 seconds. It means it should not be more than 3 little squares. आपकी जो small squares हैं ECG graph paper पे, तीन small squares के अंदर ही QRS complex होना चाहिए. अगर उससे ज्यादा है, it means the person has a wide QRS, which is not normal. Okay, तो rule number 1 कहता है the PR interval should be between 0.12 to 0.20 seconds. Second rule says that the QRS complex should be less than 0.11 second. Now the third rule says that QRS complex should be dominantly upright in lead 1 and 2. अगर आप यहाँ देखेंगे, this is your lead 1, then lead 2, then your lead 3. And these 3 are your leads AVR, AVL, and AVF. Okay, all these 6 leads are known as limb leads. So as per rule number 3 of Dr. Chamberlain, what you have to remember is the QRS complex should be upright. Upright का मतलब क्या है? This is your isoelectric line, the line where the ECG waveforms forms, that is your isoelectric line. इससे ऊपर है तो upright है, इससे नीचे है तो negative deflection है, right? तो as per rule number 3, the QRS complex in lead number 1 and lead number 2 should be predominantly upright. तो आप यहाँ देखोगे QRS complex is in the upright direction. Here the QRS complex is again in the upright direction, which is normal. Now, rule number 4. As per rule number 4, the QRS and T waves should have the same direction in the limb leads. So all these 6 leads which are depicted here in this slide are your limb leads. कौन सी है? Lead 1, lead 2 and lead 3 plus AVR, that is augmented vector right, AVL augmented vector left, AVF augmented vector foot. So आपकी इन 6 की 6 leads में there should be QRS and T wave concordance. Concordance means अगर QRS आपका upright है, positive deflection है, तो T भी upright ही होना चाहिए, positive deflection ही होना चाहिए. और अगर आपका QRS जो है वो negative deflected है, तो T wave भी negative deflected ही होनी चाहिए. It means they are in concordance with each other. अगर वो उल्टा है, QRS जो है वो upright है और T wave जो है वो negative deflected है, then it will be a discordance. So as per rule number 4, all the limb leads should contain QRS and T waves which are in the same direction. तो आप यहाँ देखेंगे, the QRS is positively deflected, positive vein है यहाँ पे आपके पास, और ये आपका जो T wave है वो भी positive ही है. Here also QRS and T are in the same direction, but if you'll see here, the QRS is in the downward direction, same way T wave is also in the downward direction. So there should be concordance of QRS and T wave in the limb leads. As per the rule number 5, all waves in lead AVR are negative. राइट जो आपकी आइसोइलेक्ट्रिक लाइन है, नॉर्मली क्या होता है, ये सारी वेव्स जो हैं वो पॉजिटिव होती हैं, बट इन द लीड AVR, दैट इज योर ऑगमेंटेड वेक्टर राइट, योर P wave is negative. You can see here QRS is also negative and your T wave is also negative. So this finding in the lead AVR is normal. Then rule number 6. As per rule 6, the R wave should grow from V1 to V4 and the S wave should also grow from V1 to V3. तो अगर आप chest leads को देखोगे, right? V1 to V6 are known as your chest leads or the precordial leads. तो precordial leads में from lead 1 to V4 there should be a progressive increase in the R wave. आप यहाँ देखिए R wave जो है वो छोटी सी है, V2 में थोड़ा बड़ा हो गया, V3 में थोड़ा सा और बड़ा हो गया and V4 में और बड़ी हो गई and afterwards it is again going becoming small. Okay, so there is a progressive increase in the R wave from V1 to V4, which is normal. Now you will see the S wave. This is your S wave. S wave is a small wave here comparative to V2. V3 में और बड़ी है वो and V4 में वो छोटी हो गई, right? So from V1 to V3 there is a progressive increase in the dimension, in the amplitude of your S wave, which is normal. So as per rule number 6, there is a progressive increase in the R wave from V1 to V4. And there is a progressive increase in the S wave from V1 to V3. And these leads are your precordial leads or the chest leads. Rule number 7 के हिसाब से, the ST segment should start in the isoelectric line in V1 and V2 where it may be elevated, right? तो आपके पास सारी leads में the ST segment should be in the isoelectric line. जो ये line है जहाँ पे ECG formation है, wave formation है, the ST segment should be above that isoelectric line, but except your V1 and V2. Here you can see you have the V1 here and here you have the V2. So V1 और V2 में क्या होगा? Here you can see the ST segment is starting above the isoelectric line. और यहाँ पे भी आप देखो the ST segment is starting above the isoelectric line. So this is normal. ठीक है, अगर V1 में और V2 में ST segment आपका isoelectric line से ऊपर start होता है, it is normal. You will not be calling it as STEMI. But अगर बाकी leads में it is like starting above the isoelectric line except V1 and V2, it might indicate any kind of myocardial ischemia also, right? In your rule number 8, the P wave should be upright in lead 1, 2, and from V2 to V6. So आपका rule number 8, 9 and 10 इन्हीं leads की बात करता है. कौन कौन सी leads की बात करता है? Lead 1 की, lead 2 की और lead V2 से V6 की. So as per rule number 8, the P wave should be upright. मतलब they should be positive waves. The P wave should be positive in lead 1, in lead 2 and in lead V1, sorry, in lead V2, your V3, your V4, V5 and V6. The P wave should be upright in these leads. As per rule number 9, there should not be no Q wave, or if there is a Q wave, it should be very small. Kitna small? Less than 0.04 seconds. It means smaller than one small box, right? In width, in lead 1, 2, V2 to V6. अब इन्हीं की बात करेंगे अभी रूल नंबर 8, 9, 10 में. तो एज पर रूल नंबर 9 जो आपका Q वेव है, यहाँ पे Q वेव है P के पास में, तो या तो ये बहुत होना ही नहीं चाहिए, दिखना ही नहीं चाहिए. अगर ये दिख रहा है तो इट शुड बी लेस देन 0.04 सेकेंड्स. अगर उससे ब्रॉड है, उससे डीप है, इट मीन्स इट इज नॉट नॉर्मल, राइट? देन एज पर योर रूल नंबर 10, the last rule says that T wave must be upright in these leads. ठीक है, जो आपकी lead 1 है, 2 है और V2 से V6 तक leads हैं, the T wave should be positive. The T wave should be upright in these leads. There should not be negative or downward direction in these leads. So these are the 10 rules which are been given by Professor Chamberlain. And whenever you see any ECG, you try to correlate the ECG findings with these rules which are given to identify the normal ECG. So thank you so much. If you want me to cover any other topic related to the normal ECG or any arrhythmias or any blocks, please let me know in the comments. Thank you so much.